you work in a healthcare facility, whether it be the hospital, nursing home, doctor's office, you come across several patients on a day-to-day basis, maybe not every single day, that have MRSA or the staph infection. They may come in with the flu. These are things that we're used to seeing. But then you get your patient or an individual that comes in with HIV. How do you react then? How do you react to them, to the patient, to the family? Do you refuse to take care of them? Do you decide to take care of them, but you don't really treat them, with the same respect that you would another individual? This is sad. This is going on everywhere around the world. Doctors, nurses are turning away these patients that are infected with HIV. It is unethical, and it is very much illegal. But it's going around, and it's happening. There are numerous individuals out there that are mothers, sisters, brothers, that are out there hardworking individuals that you would never think had this disease. And that's because a lot of these individuals don't typically show overt signs and symptoms of the disease at first. So what are these diseases, or what are these symptoms? Well, according to the National Institute of Allergy and Infectious Disease, early stages of HIV, you typically show signs of flu-like symptoms. You're looking at your fever, body aches. This can last for maybe about a month. Then you go into the later stages where you have your immunocompromised, weight loss, sores in the mouth, swollen glands. And this is when the patient becomes identifiable. And this is when the discrimination comes in. And a lot of these patients are scared to go and get treatment because when they look this bad or when they've lost this much weight, they know, okay, it's time for me to go get treatment. This is when they start to get discriminated against. You can't tell at first when someone has this disease. Like I said, they just show that flu-like symptoms. But then they show those the later stages of the symptoms. And like I said, this is happening everywhere. These patients are being discriminated against. And what's sad is we don't even know their story. We don't know how they contracted this. So we as healthcare workers and individuals, we need to be educated a little bit more about this disease. According also to this National Institute of Allergy and Infectious Disease, you cannot contract this just by shaking someone's hand. You can't contract this from eating off their plate or drinking after them, not even kissing. This is present in blood and semen, so engaging in intercourse with individuals that are infected, your IV drug users, sharing needles, these are ways that this is contracted. And if us as healthcare workers and just individuals in general can learn a little bit more about this disease and ways to prevent contracting it and just taking the universal precautions, we can prevent the spread or the contraction of this disease. But we can also feel better about taking care of these patients and not having that fear. In the 2009 Journal of International AIDS Society, studies from different parts of the world reveal that there are three main immediately actionable causes of HIV-related stigma in healthcare facilities. One being the lack of awareness among healthcare workers and what the stigma looks like and why it's so damaging. The fear of casual contact. like I said, with shaking the hands or just touching them in general. And then the association of HIV with improper and immoral behavior. And like I said, the stigma seeks people to seek treatment later on in this disease, which just makes it harder on the patient. Even individuals in South Africa, I read, that were positive for HIV were crushing up their pills into powder because they didn't want to take them whole pills, in front of people. And this can lead to inconsistencies with their doses. So how can we prevent this stigma? How can we help these patients not feel so discriminated against? Well, we need to have immediate awareness. We need to learn more as healthcare workers and just individuals in general. We need to learn more about this disease and ways to go about handling patients with this disease. Just because these patients have this disease doesn't make them any different than you or I, other than the fact that, they're going to have a harder life, and we need to understand that. We need to address healthcare workers' fears. Again, this goes with educating. Facilities need to have more information regarding this disease. We need to make sure and have supplies in the hospitals or the healthcare facilities, like including gloves, sharp container boxes, hand soap, things that you're going to use for your universal precautions. And doing these, I think, will help with this stigma out there. In the 2009 December American Medical Association Journal of Ethics describes how important it is to test for HIV and how important it is for people to get tested and to understand this disease. Stigma reduction is the first step in creating services to address the needs of HIV positive healthcare workers. In this profession, it is our ethical duty to avoid discriminating. And it is also illegal too. Healthcare personnel and even individuals in general need to take into account what these individuals that are positive for HIV have to go through and have to live with.